Welcome to Medscape. I'm your host, Dr. Andrew Wilner, reporting virtually from the 2023 American Academy of Neurology meeting in Boston, Massachusetts. Today, I have the pleasure of speaking with Dana Allison about her presentation, A Survey of Virtual Reality Interventions for Autistic Spectrum Disorder Therapy, a Neuroscience Perspective. Dana is a medical student at the University of Vermont, Larner College of Medicine. Greetings, Dana. Thanks for joining us.
Thank you, Dr. Wilner, for having me. I'm so excited to be connected with you before our conference.
Yeah, and me too. And I'm excited to learn more about your presentation. So why don't we start? Give us your background and how you got interested in this topic.
So I was introduced to autism in the summers that I was spending volunteering at the Head Start program. At that time, I was working with preschool age children. And at that time, I became fascinated with the children who were on the spectrum, in the fact that some were more interactive and social and others were more restrictive. And at that point, I combined that with my background in computer science and understanding augmented reality and virtual reality to maybe understand that we can probably use this virtual tool to be able to help children on the spectrum at this, critical age obtain the critical social and communicative skills necessary for them to be able to thrive as adults.
All right. So how did you, in your paper presentation, how did you diagnose autism? Because as you mentioned, it's a spectrum. So which children did you choose? So
when I was surveying the literature, many of the studies focus on, I believe it was high functioning autism, both genders and from ages 6 to 16 years of age.
All right. So tell us about virtual reality. When I think about virtual reality, I think about some fancy headset and a guy walking through, a swamp or outer space. And I don't know. How would you apply this? Would these children wear some sort of headset, or is it on a screen? Or tell us, what are we actually talking about?
So in my investigation, there was a few studies that would maybe give the child a device that they would apply to their head in a controlled, safe environment, and the clinician would also use the device to be able to interact with the child in a virtual environment. I believe this way was helpful for the children because it kind of provided a safe space for them without distraction or any kind of stimuli that would, induce anxiety in them, so that they can be able to focus on the critical social skills and be able to reinforce that without any kind of disruption to that. So with that being said, that is one element of it. Another element is to have the child look at a screen where the embodied agent or the conversational agent would interact with them without the device. But the program would be designed by the computer scientist and the clinician to be able to, provide the child with cues where they can be able to interact with it accordingly. And with that, they would be able to quantify the number of positive interactions to be able to understand how this population responds well with the technology.
So you reviewed a bunch of studies that had all used virtual reality in one way or another. Was the primary goal of these research studies diagnostic? Was it to understand the children better, what they could do and what they couldn't do, with strengths and weaknesses? Or was the primary goal for it to be an adjunctive therapeutic modality? There's only so much one-on-one that the teachers can do. Was the idea to do, is it a therapy? Was that the plan?
I selected for four articles. 3 of the articles were used to train the children to acquire social skills, to be able to recognize facial expressions within specific contexts. and only one of them was, I guess, in a way, assessing how interactive a child could be on a in the context of diagnosis, to be able to maybe convey like a baseline.
Was there any comparison with typical children? In other words, were children on the autistic spectrum more likely to respond to virtual reality or less likely to respond to virtual reality? Was there any information about that?
Yes. One of the studies that I included in my investigation, the outcome basically conveyed that children with ASD were preferably interactive with the technology and compared to their control counterparts.
Well, that's very exciting, because part of the difficulty in teaching children with autism is getting them to engage, right? They're kind of self-engaged in whatever it is they're doing and not necessarily interested in engaging with the teacher or their colleagues or peers. Mm-hmm. So if you have a modality where they want to engage with it, presumably that would be a entry point, good entry point for teaching. Was that your assessment too?
Yeah, that was my assessment. An example would be, I believe there was a software program called Second Life. And in this software program, the child would be able to take on a avatar within a virtual reality environment. And the clinician would also take on an avatar, and a second clinician would also take on an avatar. And the clinician one would be able to give the child instructions about where to be in this environment and what exercises to complete, whether it's maintaining relationship, conflict resolution, things of that sort, with the second clinician, which would kind of function as a decoy. So it would kind of provide this safe, realistic environment where they're able to control for a lot of the factors that might interfere with, optimal skill acquisition in that sense. So it, for the most part, it yielded positive feedback, and it shows a lot of promise.
All right. So I recently did an interview with a company in Australia that created a VR system for children who are requiring medical procedures, insertion of an IV or some, uncomfortable kind of hospital situation. And they found that it worked very, very well. And the same idea, kind of gave them a space, and they had animated characters, here comes the butterfly, it's going to get a little pinch, and that was the IV. And seem to really relax the kids. So to me, it's a little kind of antithetical that you can get better response, virtually than you would think. There'd be nothing better than one-on-one, but with a human being. But it may be for children on the spectrum that you can actually get their attention better by removing that, or at least putting some distance between the real human being and the child, with the hope that the skills that are acquired virtually would then be transferable, right, at some point to the real world. That's the goal, right?
I agree. Yeah, I'm happy that you provided this example. That was also another one of the studies that I included in my investigation, where they were, I guess, surveying ASD children and their ability to self-regulate their emotions in the context of anxiety producing triggers. So with that, there was a pre-survey and a post-survey done, and they were able to, the virtual agent would basically expose the child to increasing levels of their trigger. And with that, over time, the child was able to understand the cues in the context and report lesser levels of experienced anxiety and greater confidence in their ability to manage those same scenarios. And this was quantified over a 6-month follow-up to a 12-month follow-up and a 16-month follow-up with lasting results. So I'm happy that this technology is able to elicit effective and lasting results.
Yeah, so it really worked in the real world.
Yes, it did.
That's pretty exciting. Now, you are a 4th-year medical student. So ready to go out into the real world yourself, right?
Yeah.
So is research into autism going to be part of this, or you're not sure yet, or do you have another direction?
So I'm happy that my work was recognized at this conference, and that kind of provides me with the encouragement to continue on the same line of research. My preceptor, Dr. Patricia Prelog and Dr. Jeremiah Dickerson, they're experts here in autism at UVM, and I was fortunate and able to connect with them, and they provided me with the necessary resources so that I can understand the clinical portion of autism, to understand how this technology can further evolve and provide us with, better outcomes in a sense.
Well, soon to be Dr. Dana Allison, I want to thank you very much for sharing your research with Medscape.
Thank you so much for having me. Thank you, Medscape.
I'm Dr. Andrew Wilner, reporting for Medscape.